Hi, I'm Dr. Bernardo Mendes. I am a vascular surgeon at the UCLA Health Aortic Center.
And I'm Dr. Peter Downey. I'm an adult cardiac surgeon at the Aortic Center.
Not every hospital is set up to do endovascular aortic repair. High-quality imaging in a hybrid operating room is key.
A hybrid OR is a special operating room. Surgeons can do both open and endovascular surgery in these operating rooms. It has a sterile setup of a standard operating room, and it adds on powerful imaging tools. This imaging gives clear, real-time pictures of the aorta and the devices we're placing. The hybrid room reduces risks and improves success.
Aortic aneurysm patients are often medically complex. Many have other health problems such as heart disease, diabetes, high blood pressure, or kidney disease. If there is a complication, these patients don't always have the stamina to recover. The hospital must be ready to manage issues quickly to get the patient through safely. Finding and treating complications is often what large academic centers do more frequently than smaller hospitals.
A strength of our program at UCLA Health is teamwork between cardiac and vascular surgeons. The parts of the aorta require different training and different amounts of expertise.
For example, a life-threatening aortic dissection is a true emergency where the inner wall of the aorta tears. In this case, we perform an initial fix with open, traditional heart surgery. For the dissection operation subsequently, we repair with an endovascular approach. This saves the patient from another major surgery and longer recovery.
Teamwork is key in these staged repairs. When we plan together from the start, we can design the first repair so the second repair is simpler and safer. This exchange helps us tailor the treatment to each patient.
At UCLA Health, we have built a program that is unique on purpose. Our motto is based on sharing knowledge and planning as a team. Our goal is the patient's success, no matter who performs the repair. That culture makes our outcomes stronger and our repair safer. It makes our program one of the best aortic centers in the region.